All right, and we are on our last section of Unit 8, which is the different types of modes of therapy. And then we'll talk about the last type of model, which is the biomedical approach. All right, so let's go into the types of therapies that are out there. The first one is the individual psychotherapy, a lot more common, and that's basically where it's just the therapist and the client. Okay, it's an individual type of therapy. Then you have what's called group therapy, and group therapy is conducted with a group, and it's with individuals that tend to have very similar problems, and they will share. Okay, sometimes it's led by a therapist, and so some really common ones that we hear is AA. Now, mind you, that is not guided by a therapist, usually people that are in the program. Okay, but group therapy can be very beneficial so that the person knows that they're not alone. It allows for others to give them feedback and then trying new ways. Okay, so that's group therapy. The next one is self-help groups, and self-help groups are basically people that have a common goal, by giving each other feedback. I'm sorry, not feedback, by giving them support, to help them. Sorry, yeah, I made a mistake. So group therapy is not AA. Self-help groups is AA. Okay, group therapy is led by a therapist. Self-help group is just a group of people that are coming together. They typically have a facilitator, but they're not trained in psychotherapy. Okay, so that's the difference. And again, this is really good for people that so they don't feel like they're alone, and they just have somewhere to, like, their goal is to be better. Okay. The next one is couples marriage counseling, and this is where they're a couple or marriage partnership are coming together to speak to a therapist so that they can work on better communication. It allows for them to learn how to deal with conflict with one another and then communicating and understanding each other. Okay. And then the last one is family therapy. And family therapy is basically where the whole family is the focus. It's not just one person. And then they work together to what's called the family system theory, okay, in which everybody in the family plays a role and affects one another. And so what they do is they see how like each person's role in the family and like the dynamics of it, and then kind of replacing those conflicting, problems that they're having with replacing them with healthier relationship skills, right? Communication, conflict resolution stuff. So that's what they're doing. Okay, so effectiveness of therapy is the next one. What makes a therapy effective and works well? Okay, there's kind of three factors of what they found, what makes the effectiveness of therapy. And the first one is going to be the therapeutic alliance, right? Which is basically the relationship between the therapist and the client, right? Do they mesh well? Do their personalities are, is one person more empathetic, they like understanding of the person, okay? And that could take some time. Another one is positive expectations, right? That the client has to believe that there is going to be a positive outcome to the therapy, okay? And they agree to like their goals and tasks that they need to do in order to achieve that, right? They can't just be like, oh yeah, this is gonna work, but the therapist is gonna do all the work. No, the client has to know that they also need to do the work. Okay. And then the next one is a specific action plan that in which the therapist will create an action plan for the patient. And then the patient is working towards, whatever the plan is in order to develop new coping behaviors or skills. Okay. And then we're going to go to the last section, which is the biomedical approach. And so biomedical approach is they're going to look at what's called the psychopharmacology, and which psychopharmacology is basically the study of the effects of drugs on the mind and behavior. Okay, now in order to get to this point, they have to do a research. Okay, they have to do a like an actual experimental in which they're going to have a control group and they're going to have an experimental group. Okay, this is typically where they'll have like the placebo, right? They give the control group the placebo pill, and then obviously the experimental group will get the actual medication. This is a really good research, like when they're doing this type of research with medication, it's good to have a double blind procedure, because that makes sure that there is no researcher bias. Escríbelo. Okay, so we're going to talk about the different drugs as well as the different approaches under biomedical, right? Because it's not doesn't just have to be medication to for this approach. Okay, so the first one is going to be antipsychotic drugs, and these are typically medications that are there to treat schizophrenia or really severe thought disorders, right? Such as bipolar, or people that are having, hallucinations or paranoia, or even confused thoughts. Okay. Now, in the antipsychotic drugs, they are the chemicals that are in this medication act like antagonists, okay, like the neurotransmitters. And what they do is they basically block the receptor sites so that they do not release those chemicals, okay? So it's not so much the reuptake, it's not allowing them to be released, because typically what they've seen is that people that have like schizophrenia or bipolar, they have an increase or excessive dopamine. So what this medication does, it blocks it from being even released into the synapse. Okay. And again, they always say that it is good to, have medication and then therapies, right? Like individual therapy, so that the medication helps with like the maladaptive behaviors, like tone them down. So then the therapies they could practice, those behaviors are not as prevalent. Okay. Now, there's obviously always some side effects to some of these medications. Some of them can be like sluggishness, maybe some tremors, okay? So that's antipsychotic drugs. And just know that those are for like schizophrenia, bipolar, more severe disorders that are more disorienting. Then they have this anti-anxiety drugs, okay? And this is what basically suppresses the central nervous system. And then this is typically really helpful for people with like PTSD or OCD, okay? They actually use now, what they're using more is depressants for people with like PTSD or OCD, right? So you think it's kind of like the opposite. If somebody's anxious, give them an antidepressant. But that's what they've seen. It's been working a lot more. Now, going on to antidepressants. Antidepressants are basically there to treat disorders such as anxiety, OCD, some mood disorders, or like some with depression, okay? And so what they do is it arouses the mood, and then it allows for this one acts like an agonist, which is basically increasing the availability of certain neurotransmitters, such as, you gotta know this, norepinephrine or serotonin. Okay. And typically what you will see, and we've talked about this many times, they're usually called SSRIs, okay, which is selective serotonin reuptake inhibitor. And this is where it blocks the reuptake of the serotonin so that it stays more in the, oh my gosh, forgot the synapse. So then the receptor sites can take in more serotonin, okay? Because what they found is that people with depression, anxiety, they are lacking serotonin, okay? So this is where they'll take 1 second. Okay, and then the last one is going to be what's mood stabilizing medication. And this is typically for people that have bipolar, is the medication that they will give them. And this is typically like lithium is what they're giving them to reduce their mood, okay, that it's more stable. All right. So if they're not giving medication, what are some other approaches that the biomedical model uses? Okay, and they use some brain stimulation. And the first one that they use is electroconvulsion therapy. And this is typically for people that are really severely depressed. This is usually what happens like after they've tried medication, multiple medications. Oh, before I forget, go back to the medication and please put that the one that is going to prescribe all of these medications is going to be a psychiatrist, right? Remember that the psychiatrist is a medical doctor that goes to med school, and the last year of residency, what they specialize is going to be in more of that psychological disorders, and they study the medications, and the effects of these medications on a patient. That's why it's always good that if people are taking any of these like anti-anxiety, antidepressants, that they are going to a psychiatrist. Okay? All right. So what happens if those medications don't work? They're going to use the first one is the electroconvulsion, and this is for severely depressed patients. And what they do is they basically give them a brief electric current to certain parts of the brain. Okay, and this is like for about 30 to 60 seconds, and then that's basically it. They'll have like 3 sessions each week for 2 to 4 weeks. And then they have shown that there's about 80%, there is some improvement. Some side effects, there could be some memory loss. Now, again, this is typically for really severe cases of depression. Now, the next one is what's called the alternative neural stimulation therapy. And this is going to use magnetic stimulation, okay? And they call this the what's called repetitive transcranial, I forget this one because this is probably a little tired. But this is repetitive transcranial magnetic stimulation. And this is where they're going to apply a repeated application of repeated pulses of magnetic energy to the brain, okay? And they use this to stimulate or suppress certain brain's activities, okay? And then they say that this will help them grow like specific neurons, okay? And then this is also used to reduce symptoms of depression, all right? And this one typically produces no seizures, memory loss, or serious side effects. So it's the one that's used a little bit more often. They are not sure how it works, but they're saying it helps with certain parts of the brain be inactive that are always active with people that are depressed. Okay? And then there is a deep brain stimulation. And then this is where they're going to put like a thin wire that's surgically implanted into parts of the brain that are associated with depression. And then they're just going to, it's like an electric current for that. Okay, but that one is surgery. Okay, and then there's the cycle surgery, like they have to do a surgery like to put the wiring in there. Okay. And then the psychosurgery is basically where they're going to remove or destroy brain tissues that are that they see as a problem, still used today. And this is basically a lobotomy in which they will take a part of the brain, a portion of the brain, or destroy a part of the brain that is, well, they remove that part of the brain in order to um, make sure that, like, to control their emotions and some of their behaviors. This is typically for people that have uncontrollable emotions or really violent patients. Okay, and then that is it for Unit 8. And that on a great note, didn't we? Lobotomies. All right, guys, we're done with Unit 8. Yay!